Today we are going to be talking about hemophilia. And I chose hemophilia because I knew the term meant the patient would be a bleeder. And I figured that'd kind of be important if I was a dental hygienist. And then it was in the textbook and we did a whole chapter on it. And I was like, yes, it is kind of important for us to know. So I was really excited to research about hemophiliacs, and I don't really have any personal relationships to any hemophiliac, but I was excited. So, to define hemophilia, it is commonly known as an inherited bleeding disorder in which blood does not clot properly. This can lead to excessive bleeding after injury or surgery and can be spontaneous. Blood contains proteins referred to as clotting factors. Type A and Type B patients have a lack of either factor 8 or factor 9. The lower the levels, the likeliness of spontaneous and or excessive bleeding increases. Acquired hemophilia comes in individuals later in life and they are not born with the disorder. There are platelet disorders identified as Bernard-Sawyer disease and Glanzmann thromboasthenia. Hereditary hemorrhagic telangiectasia is a rare vascular disease, and there are 4 hereditary connective tissue disorders. I don't know how to move my face, but we're just going to keep going. Okay, etiology continued. So Bernard-Sawyer's disease is a disorder of platelet adhesion to VWF, which is caused by a lack of glycoprotein, IB, on the platelet membrane. These platelets are unable to bind to VWF and thus are unable to adhere to the subendothelium. Glanzmann thromboasthenia is a disorder of platelet aggregation due to abnormality of the platelet membrane complex glycoprotein IIB/IIIA that allows platelets to adhere to the subendothelium but not to fibrinogen. Hereditary, the HHT is a disorder consisting of multiple telangiectatic lesions involving the skin and mucous membranes. This occurs because of inherent mechanical fragility of the affected VWF. Pathophysiology and complications. Deficiency of one of the coagulation factors, abnormal construction of platelets, deficiency of von Willebrand factor, malfunction of vessels, inherited from the X chromosome. So if a male has a hemophilia ally on his only X chromosome, he will have the disorder. Hemophilia A and B prevents blood from clotting properly. When blood doesn't clot properly, it causes patients to experience bleeding in the joints, which can lead to joint disease, pain, and limitations. Females experience milder symptoms compared to men. The signs of symptoms for a hemophilia patient would be petechia, ecchymosis, excessive bleeding, and symptoms are specific to the disease. The diagnostic test used for hemophiliacs is activated partial thromboplastin time, prothrombin time, and the platelet count. Medical management. The first step is to find which bleeding disorder the patient has. Hereditary hemorrhagic telangiectasia involves laser surgery, estrogen plus progesterone, and thalidomide. Von Willebrand disease patients, we would use despressin administered nasally, aminocaproic acid, and factor VIII replacement that retains VWF. Hemophilia A patients, we would give despressin, aminocaproic acid, and factor VIII. Hemophilia B, desmopressin, aminocaproic acid, and factor IX. If antibodies to factor IX start to develop, PCC, APCC, factor VIIA, 9A, or steroids can be used. Bernard Sawyer and Glanzman thromboasthenia would be platelet transfusion, desmopressin, or factor VIIA. Oral manifestations in a patient with hemophilia would look like spontaneous or excessive bleeding in the oral cavity, ecchymosis in oral cavity, and petechia in the oral cavity. The image here to the right shows swelling of the submandibular region in a patient with hemophilia caused by bleeding after intraoral trauma. You can see here underneath with his mouth closed, that submandibular region is all swollen, and then the inside of his mouth just looks very bloody. Medications used for oral procedures would be aminocaproic acid is used to keep blood clots from breaking down after an oral procedure, and tranexamic acid can be used orally or in a mouthwash to help after scaling. So whenever I researched that and saw that there were medications that we would give a patient with hemophilia, honestly, whenever I did any of the research, I found out it's actually, I will get into it, but they are like, hemophiliac patients are our top priority in a dental office just to prevent crisis. So the dental management precautions or modifications. Patients with inherited bleeding disorders are dental providers' top priority group of dental and oral preventive health care. So that's whenever I saw that, I was like, okay, so I was onto something whenever I chose this. It is important. So then we always want to consult with a patient's hematologist. The patients might neglect to brush teeth in fear of excess bleeding, which I can understand. Yeah, I don't want to bleed just brushing my teeth. That's annoying. And then we would give fibrinolytic agents for excessive bleeding during infancy whenever they're teething. And then we want to leave primary teeth to fall out on their own to prevent excessive bleeding. If a dental provider extracts tooth, the patient should bite gently on a gauze. Put pressure. Children might experience bleeding or oozing when teeth erupt, so that's kind of helpful to know. Like if I do have a pedo patient, parent calling, like, oh my gosh, what's happening? Well, your son's a hemophiliac. Most likely it'll be a boy. And then educate patients to eat cold or soft food like yogurt to preserve the blood clot. And orthodontic patients can be offered wax to cover rough metal and prevent rubbing and irritations of the cheeks, lips, and gum tissue, which I was offered wax, and I'm not a hemophiliac. It just really helps. And yeah, if I'm bleeding from just being nicked by my braces, that would be it's like the quality of life, that you're just constantly dealing with these excessive bleedings, or even like the bruising that occurs from trauma. Like the bruises are way worse than any bruises that a normal person would have. So then antifibrinolytic agent or desmopressin can be used during excessive bleeding in the oral cavity. And then we want to avoid aspirin containing compounds, and NSAIDs, acetaminophen, with or without codeine is suggested. Stay away from block anesthetic injections in patients not on desmopressin, aminocaproic acid, or factor concentrates. Allergies can happen in patients placed on factor VIII replacements. Devices like splints may be constructed before multiple extractions or surgical procedures. And follow-up should be made within 24 to 48 hours after surgical procedures.